People worldwide are in some way impacted by the current COVID-19 pandemic, and it's also changing our brain chemistry. The virus has prompted the development of negative psychological effects due to social isolation, fear of infection, and financial loss. Despite mental health problems increasing during this time, many healthcare professionals do not receive enough training on providing care for mental health. Education around neuroscience and mental health is a powerful tool in combating the negative effects of long-term stress and anxiety. One of the many functions of the brain is the formation of emotions. Emotions are a catalyst to convince the rest of the body to act according to our environment and experiences. Emotions are linked to specific chemicals released by neurons. These chemicals, called neurotransmitters, are molecules that communicate between neurons, target cells, and chemical synapses. Specific regions of the brain have collections of neurons that release neurotransmitters through axons into widespread areas of the cerebral cortex. These connections transmit specific neurotransmitters between brain regions and are important to many aspects of the nervous system, including emotions and consciousness, and dysfunction of these signals can be related to disorders which have a large influence in your mental state. For those highly impacted by the virus, there is likely an imbalance of the three chemicals dopamine, endorphins, and serotonin. Dopamine is involved with motivation and pleasure, endorphins help minimize pain and trigger a positive feeling, and serotonin regulates mood, sleep, and memory. Low levels of any of these chemicals have been linked to depression, PTSD, and anxiety. However, mental health is much more vast than chemical imbalance, as scientists find it difficult to measure neurotransmitter release. Chemical imbalance is often used to describe the function of antidepressant drugs, but there are a lot of nuances. Identifying a method to measure the activation of chemicals may be the next step to develop effective treatments for mental disorders. Currently and after the virus subsides, many will likely experience long-lasting trauma, some of whom may need psychological help. Conventional treatments of the effects of the COVID-19 virus are pharmaceutical medications. These medications are designed to alter neurotransmitter levels but have many limitations and side effects. They manipulate the body to increase a specific neurotransmitter activity at the expense of lowering the production of important cellular structures such as neurotransmitter receptors. With a predicted increase in the use of these medications to decrease depression symptoms, another method is needed to address psychological needs which do not limit the brain. If we were able to determine which type of treatment can lead to the highest activation of happy chemicals, we can likely find the most effective treatment to treat psychological disorders. Harmless methods like exercise, balanced nutrition, nature, meditation, gratitude, and happy memories may be best suited for subsiding negative emotions during a pandemic. Thanks for watching.